Today we are starting a new segment helping you keep your heart healthy. Heart disease is one of the leading causes of death for both men and women in the U.S. and it claims just under 700,000 lives a year. Right now we're joined by Dr. Cardio-oncologist from Lee Health telling us what we can do right now to keep our hearts healthy in the long run. Dr. Kao is with us. Dr. Kao, thank you for being here, first of all, and thank you for bringing this program here to Southwest Florida, the Gulf Coast. You've been here about 2.5 years, you were telling me.
Yes, that's correct. I came about 2.5 years ago, and my goal was to rebuild the program which we had here previously.
Can you explain what it is? Obviously, we know a cardiologist, we know an oncologist. How do they merge?
Yeah, so that's a great question. So cardio-oncology, I always say, sits at the intersection of cardiology and oncology. Mm-hmm. What I do every day is take care of people who are undergoing active treatment or have undergone active treatment for cancer. And what I do is making sure that their hearts are healthy. And what we know is a lot of our cancer treatments that were previously administered or are being administered today are potential for possible heart side effect inducing agents.
Obviously, chemo is something that can bring you to your knees, and your heart is no different with that. How do you watch for some of the signs that somebody may need to come to see a specialist like you, and then how do you go about treating them?
So we always hope nobody has symptoms from a heart standpoint when they're receiving chemotherapy or chemotherapy-like products. Unfortunately, some of our patients do experience heart side effects, and a lot of those are what I would say heart failure related symptoms. So things like shortness of breath, chest discomfort, swelling in the lower extremities or elsewhere, or heart palpitations or fluttering or skip heartbeats. Now, a lot of times we do have the tools available to us at Lee Health where we can pick up what we call subclinical side effects, meaning before symptoms occur.
Okay.
And this is where I always emphasize with our oncologists and our patients to be screened early, if you will. So we have advanced imaging options, things like cardiac MRI, and our echocardiogram studies. In this day and age, we are able to do something called global longitudinal strain, which we offer routinely at Lee Health to screen for possible side effects that are early.
Wow, these are certainly specialty patients, and you mentioned people who are undergoing active care as well as post-care. If some of our viewers out there have gone through chemotherapy and cancer, or maybe are going through it now, what should they be watching for, and perhaps bringing up to their doctors?
Yeah, absolutely. Some of those symptoms I mentioned earlier, the shortness of breath, chest pain, swelling. I also tell folks, if you're not feeling quite the same as you're getting your treatments done, it could be something that's happening from a heart standpoint. A lot of times we do have folks with very nonspecific symptoms, and a lot of times it is difficult to differentiate between just a routine chemotherapy side effect and a possible heart side effect. So, we are working very closely with all of our oncologists here locally. I'm happy to say, we're kind of their go-to folks to evaluate their patients. So if anything concerns any of our patients out there in the community, I always encourage folks to just speak up and let the oncologist know, and they'll know who to refer the patients to.
It's a wonderful resource to have, and we're so grateful for your team.
Thank you.
How could our viewers get in touch with you if they have any more questions about the specialty or getting help?
So the best way to do this would be to go on the leehealth.org website, and we do have a web page, if you search cardio-oncology, where it outlines where office locations are, and we have an office number there where patients can call. But like I mentioned earlier, our oncologists work very closely with us. So whether they're LPG oncology or floor cancer specialists, we're kind of their go-to team. So if any of the patients are experiencing anything that are concerning, I ask please let the oncology team know, and they'll get in touch with us.
Dr. Kao, thank you for being here, and thank you for what your team does. We sure appreciate it.
Thank you.
And we'll put a link as well to Lee Health on our Gulf Coast website as well as our app if you want to see more details about any of that. 9:25 is the time.